there is questions about how meaningful are the effects in terms of day-to-day activity. I think to highlight the positive aspect of this study, they did look at a number of primary and secondary outcomes, including activities of daily living measures, and the results are quite consistent in all, or at least most subgroups that they considered, and obviously in the whole population. That's exciting. However, some things are noteworthy. First of all, women, for reasons that we don't know, showed significantly less benefit than men. And that's something that clearly is going to need more attention and consideration. The other aspect that is worth mentioning is that the primary outcome was the CDR sum of boxes, the clinical dementia rating scale sum of boxes score. And overall, the benefit that the study showed amounted to about 0.5 point benefit in patients that were already so impaired that the scale itself only allows for 1 whole point increments. So it's a fairly small benefit in the metric that they used, but it did have associated benefits reported by patients and caregivers in activities of daily living. So that's encouraging. The bottom line, I think, is that attention to early diagnosis and early intervention is going to be crucial, but it will need to be balanced against the risks and against the cost, both of the assessment and of the intervention itself. The medication is going to come initially, at least, at a cost of about $26,500 per year. That's significant, but that doesn't include the need for longitudinal serial MRIs and also for a biomarker status, either through a spinal tap or a PET scan at baseline. And so there is a significantly higher cost involved, including the need of covering the cost of the infusions themselves. So it's a significant financial and commitment sacrifice from the patients, with the upside of potential benefit of slowing down the progression by about 30%, which is exciting, but it's clearly still a far step from really meaningful stopping of the disease risk and progression.